Well, let's bring in a medical doctor now, Tuyi Mebawondu, to talk more on this latest development about the monkeypox disease. It's good to have you again on the news at this time, Tuyi. Let's talk about, first of all, the government's directive or advice, for people not to panic and report all suspected cases. Suspected, what are we looking for now before you report a case to the health authorities?
Actually, the only people that can actually report suspected cases are actually the health experts themselves, medical doctors. So trained to appreciate the difference between these various rashes, whether it is smallpox, whether it's chickenpox, whether it is monkeypox. Yes, smallpox has been eradicated, whether it's even measles. So again, reporting suspected cases should be in the purview of the healthcare system, or even the people that can do what we call surveillance. The worrying thing is that every time we have an outbreak of epidemic, we rush to create Emergency Operating Center, AOC, which is like a reactive thing. We're not trying to be proactive. We're not trying to look at because what we've seen now is that we're seeing various outbreaks of epidemics in the nation. Within this year alone, we've seen like 6, from meningitis to Lassa fever to cholera, now monkeypox. So again, why are we having this, alarming rate of epidemics coming up in different...
And it's worse now that you cannot even test for monkeypox in Nigeria. So a test sample has to be taken to Dakar, Senegal. So how critical is that? So where you don't even have a laboratory here in the country to test to ascertain that this is indeed monkeypox or not? Again,
it's going to really hamper, our response in a way, and it's going to exaggerate response. Because if you ask people to actually, if you are telling people not to panic, and you cannot even confirm tests in Nigeria, you have to go to Senegal. Of course, everybody will panic. They probably think that before the result comes out, they might have experienced more of the symptoms or the spread of the disease. And let's face it, if you ask people to go and embrace agriculture, if you are now pushing for the exploitation of mineral resources, if you are now pushing for the expansion of settlement, of human settlement, those are the things that keep human beings in contact with those reservoirs, the animals that actually transmit the disease from animal to human. So now, as much as we are embracing agriculture, we're going to see more of Lassa fever, we're going to see more of yellow fever, we're going to see more of monkeypox, we're going to see more of those diseases coming out. We're in an era where we're going to see more of this epidemic and not less of it. So now, the total thing we should have been thinking about is that since we're expanding agricultural settlement, since we're expanding human settlement, since we're doing a lot of mineral exploitation, what are the medical issues that may come from this? And then we set up reaction based on that. It's not that when this one breaks out, we jump up and appear on television and give press statement, and then another one comes, we jump up and give press statement. Look at it. Most of the things you need to respond to those things are actually vaccines.
And about the press statements, is there enough awareness about these diseases? For instance, monkeypox. Some persons believe it's just about monkeys. They don't know that it's about even rodents and rats and all other things that you may have in your house that may come in contact with food. And when the food is not properly cooked, that person stands the risk of getting that disease. So how would you assess the level of awareness presently in the country?
The level of awareness is on a panic mode. That is not awareness. What we need is a thorough campaign that we can actually reach the grassroots and let people understand that squirrels, that rodents, that rats, that monkey can actually be host to these germs and can transmit it to human. Let people be aware that as long as you are clearing bush and encroaching on the settlement of these animals, they're also coming back to you and can transmit disease to you. Let us be aware that as long as you're doing your agricultural thing, now everybody's going back to farm to do agriculture. Of course, we are going to come into contact with those wild animals, which can be a source of this jump or zoonotic spark, where the organism move from animal to human. Now, of course, we need to set up, of course, it's given that we need to enhance sanitation.
So, Doctor, what's the solution here before we wrap up? What's the solution? Are we going to keep looking to the governments to bring about these laboratories and what have you to stand in or prevent these diseases or these cases when they erupt? Or can individuals coming here to do something for themselves?
Yeah, the solution is at 3 levels, the individual level, the community level, and the government level. what government needs to do essentially is to increase surveillance. Surveillance is the first response to prevent, to spot, so that we can stop outbreak of epidemics.
That's before it even breaks out.
Even from the animal, you can actually look at those and do that. Secondly, at the level of community, we need to deepen health literacy. They need to understand what they're dealing with, the environment. If they see a monkey just falling down or animal dying, they should not just take it for granted or go and pick it and eat. So they need to understand that. And at the individual level, what we need to do is to step up our personal sanitation and hygiene, so that, and then report as much as possible and not subject all the things we cannot explain to witchcraft or enemy attack. So we need to actually respond at those 3 levels.
That makes a lot of sense. Dr. Tuyi Mebawondu, always a pleasure talking with you on the news.
My pleasure.
Thank you very much once again.